So let's change our focus now to your own battle with diabetes. Here with a plan is Dr. Meena Murthy from St. Peter's University Hospital and patient Robert Dulemba. Welcome, guys. Thanks so much for coming in.
Pleased to be here.
All right, so Dr. Murthy, let's talk about diabetes. So many people are confused. You know, there's this increase in diabetes. Why are we seeing so much more diabetes these days?
Well, a lot of it is because of the obesity epidemic that we have.
Right, so we're seeing people are getting heavier and heavier, and we're seeing more type 2 diabetes,
Yes.
and that's the big difference. It's very different from type 1 diabetes.
Extremely different. A very small number of population, 5% or less have type 1. So when we talk about diabetes, we are really talking about the type 2 diabetes epidemic, which is not always in an obese person, but I would say 80% of people are overweight or obese.
Right, and that's why we're seeing these numbers. So a lot of people go to their doctor, and the doctor will say, hey, you're pre-diabetic. For some people, that's a little bit confusing. Can you explain what they mean by that?
Yeah, pre-diabetes is a good place to find out that you're at risk for diabetes. So when you're thinking about risk factors, you're thinking about family history of diabetes, level of physical activity, and what a person's weight, waist size, the amount of body fat.
So what you're trying to say basically is eating right and exercising can make a big difference if you lose the weight and the diabetes become less of a problem.
Yes.
Some people, now Robert, not you, but some people do actually require insulin eventually, and you actually have an insulin pump. Can you talk to me about that?
Sure. I have an insulin pump. I became diabetic 35 years ago, so I have type 1 juvenile diabetes. And I went to an insulin pump mainly because it provides a consistent flow of insulin. And also with the insulin pump, you have a continuous glucose monitor. It's a little sensor that sits on my side, shape of a quarter, or size of a quarter, looks like almost like a seashell, that reads my blood glucose and transmits it to the meter. So at any time, I could push a button and you could see what my blood glucose is. So at any time, I can know whether it's going high or going low and react to it before it becomes a serious problem.
Right, so in other words, you can really play with this and kind of tweak your blood sugar levels all throughout the day and adjust it.
Correct. It also allows you to, instead of taking shots, which you get some people can take up 4 shots a day, here you only have to change your setting once every 3 days. So the math is real easy. Either take maybe 120 shots a month or maybe only 10 times a month changing your setting.
All right. Well, it seems that I know patients that take it and they really love that as opposed to doing the shots. Robert, thanks so much for coming in.
Great.
Really appreciate it. Dr. Murthy, thanks so much for coming in as well.
Thank you.
All right. Well,